Welcome to the Dermlin Clinical Series on Wound Care Management. It is a distinct privilege to present to you some of my personal experiences on the use of this remarkable wound care treatment. This is Dr. Josefino Sanchez, a vascular surgeon with more than 30 years of experience in treating complicated non-healing wounds in diabetics and immunocompromised patients with vascular problems. This is a case of a 57-year-old female diagnosed with inflammatory breast cancer, stage 4, with pulmonary metastases and malignant pleural effusion, with an 8 cm diameter necrotic exudative foul-smelling lesion on the left breast for the last few weeks. Inflammatory breast CA is a rare type of invasive ductal carcinoma which initially presents with breast edema, skin redness, and may be misdiagnosed as mastitis. Cancer cells block skin lymphatics, causing the inflamed appearance. Since the skin is already involved on initial presentation, inflammatory breast cancer is considered stage 3 at the outset, provided that there are no distant metastases. Being high risk and ventilator dependent, any intervention like chemotherapy, radiotherapy, or surgery are not feasible for this patient. So I tried local wound care using octenylene wet-to-dry dressings and application of Dermlin paste, hoping to control the wound deterioration. After only a week of this wound regimen, dramatic improvement was observed with decreased suppuration, necrosis, and malodor. This is the wound after 2 weeks of Dermlin paste application, showing a healthy granulation at the base and stable epithelialization along the wound margin with an overall decrease in wound size and depth. Dermlin is a recently introduced wound healing agent with an innovative formulation. Calcium has been established as an active agent in hemostasis, epidermal cell migration, and regeneration, which are important components in wound healing. Calcium-based nanoparticles rapidly decrease open wound size by contracture mediated by release of ionized calcium upon disintegration of pH-sensitive calcium nanoparticles in the acidic wound environment. The combined silicone gel decreases inflammatory reaction and improves wound recovery index. As a result, wound healing is facilitated by active stimulation, proliferation, differentiation, and migration of epithelial cells, growth of granulation tissues through fibrin synthesis, and a decreased scar formation due to faster type 4 collagen growth. Its nano-formulation stops bleeding and exudation and prevents infection by inhibiting bacterial growth. In this histologic section of a superficial partial thickness burn, after Dermlin treatment clearly showed little hyperplastic granulation tissue, thus scarring is minimized and stable epithelialization is enhanced instead. It is simple to use. After achieving a healthy wound base with minor debridement and daily wound dressing, a very thin application of Dermlin paste was done in this patient. When confronted with non-healing wounds, proper vascular evaluation and wound care should always be done to make wound healing possible. I have tried a lot of wound healing agents before, but nothing comes close. For faster wound healing, choose Dermlin. It's truly amazing. Thank you for sharing your time and attention.